Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching the video today. We have a bilateral wax removal and skin removal for you. This is quite an interesting case. This chap's come through with reduced hearing on both sides. What you can see here is us removing what looks like skin debris. So I think we're looking at keratosis obturans on this side, which is a overproduction of skin in the ear canal. What that does then is it puts pressure on the canal wall and can block the ear canal up. If you want to know a little bit more information, we did a video explaining this a few weeks back, so I'll try and put a link on here to that video for you as well. But looking at what we're removing here is lots of layers and layers and layers of dry skin. You can see it's quite wet to the left hand side of the screen there next to the canal wall. That's where the skin started to put a bit of pressure, I think, on the ear canal. So we're starting to get a little bit degradation of the skin underneath. So you can see it's quite tough stuff. It's really kind of thickened up, hardened up skin. It's almost like a leathery consistency to it. So we're just going to try and free this up. You can see the layers there, 1, 2, 3 layers running up and down that skin there. So you can see where the skin's overlapped on itself quite a few times. Having a bit of difficulty getting a really good... we can get a good grip on it, but it's just tearing and shearing as we take a good grip on it. So we're just going to use the Jobson horn now to go in and try and loosen this up a little bit. This is quite a long video today. I think it goes on for about 12 minutes thereabouts. So if I do go quiet in places, I'm just resting my voice halfway through. What we have here is the skin is starting to break down. So as we're taking it away, that Jobson horn is really pulling through the centre of it, which is going to leave lots of little bits hanging around either side. So we're just going to tidy up with the Zollner a minute. Can you see the white skin there around the outside edge? That's where the top layer of skin in the ear canal wall has started to degrade, because this has been in here for so long. This gentleman has a bit of a fear of coming along to medical professionals, which is why it's taken this long to get to us. You can see it just starting to pull away now in slightly bigger pieces. Looking at how much is coming away, I don't think this ear canal is going to look particularly pretty by the time we finish, because there's obviously going to be a lot of dead skin and that sort of white sluffy skin in there as well. Just taking the pieces away that we couldn't get out with the Jobson. So back to the Crocodile forceps. Lots of people mention in the comments how frustrating it is when you get a grip and little bits break off. It's equally as frustrating for us professionals, I promise you. So we're just using that Jobson horn now to try and break some of this deeper skin debris. You can see it gets almost crumbly in places. So we're just going to tidy up a little bit with the Zollner. While we're doing a bit of tidying up, if anyone's not subscribed to the channel already, if you don't mind doing so, you can get a subscription. You'll see a notification then every time we post a new video. We do it twice a week now, Tuesdays and Fridays. You can see just how tough this skin material is. You know, that the Zollner can get a grip on it, but it just can't pull it apart. It's really, really difficult. There you go. Nice bigger pieces coming away now. You can see there's still a lot more in here. Can you see the whiteness to the base of the canal there, where it's been putting so much pressure on that canal that this is actually starting to degrade. Now it's very difficult to remove that white sluffy skin that you could see at the bottom, because in some cases it can actually degrade through to the bone underneath. So we don't really want to take all that away, because we're going to cause more problems by doing it. So we'll tidy up in there, but we'll let that skin regenerate then. And more than likely this gent will come back then in maybe a month or so, and we'll check him over. Still coming away. You can just see that the striations in the skin, the long strips of skin that start coming away. So this has been building for quite some time. You can see some redness there at the base, underneath this bit of wax, where this has been aggravating that skin underneath. So like I said, it's not going to probably look the cleanest when we finish, but we'll certainly get rid of all of this harder material that's in here. By taking this away, then it will allow the ear canal natural skin migration processes to carry on as they should do, which will help all this skin to repair itself. And you know, in a month's time, this ear canal will look a lot healthier than it does right now. It's always difficult when you're undoing potentially years worth of neglect, if you like. This is not due to poor hygiene. This is just one of those conditions that just can spontaneously develop in some people. So it's not that this patient, you know, has poor kind of personal hygiene. It's just that wax just accumulates in some people, unfortunately. There you go. You can see that we're starting to get to some of the deeper, harder bits. We're just getting our first view of the eardrum there. So this is backed right up to the eardrum. There we are, getting all these pieces away. You can see this has actually been pressing on the drum, so I think if this patient had left this go on a little bit longer, it would have caused a lot more issues in here. You can see all that old dead skin coming away. There's the eardrum. You can see where all this has been pressing on there. So we're just very gently just doing a little bit of tidying up around the eardrum, around the outside edge. But you can see just how aggravated, and there's lots of that old dead skin left in there. The white stuff you can see, we'll just tidy it a little bit, but you can, I'm going to leave a lot of this here, because as we start to lift this, you'll see just how sluffy all that skin material has become there. Can you see as we're lifting it? Now this is going to become quite uncomfortable for that patient, so I'm only going to do as much as the patient will tolerate, because don't forget the patients are not anaesthetized for this. So in the majority of cases, suction doesn't cause any issues as far as pain or kind of, it's quite a comfortable process to sit through. But what we don't want to do is cause any discomfort for our patient. So we'll do as much as we can. In fairness, he's sat through a lot already, so just going to get some of the older and harder bits of this stuff away. This bit's hanging on for dear life, so we're just going to pop that bit out. Using the Crocodile force just helps me to get a better grip, that's all. There we go. You can see the layers peeling away, look, in the ear canal. You can see how red the skin underneath is there as well, so this patient will probably have to keep their ears dry for about 24 hours just to stop any risk of infection. You can see how well this is holding on to the skin underneath. So we don't want to go too crazy with taking this away. I think we're going to call it a day there. This is the other side now. Now patient's been complaining of reduced hearing on this side as well. Now we can see the wax there, so we just put a little bit of olive oil in because it's quite a hardened up piece of wax. So we just want to maneuver this out. Just trying to get a grip on it with the standard size ulnar tube. You can see we can't really get a very good grip, so we're going to use the Jobson horn. Just very slowly working our way behind it. You can see just how tough this piece of wax is, having to put a lot of pressure there to guide this out. The idea with the Jobson horn is to kind of get it into the centre and bring it forwards. This one's rolling, which is okay if you've got quite a short piece of wax. If you've got a long piece, obviously that could be quite uncomfortable. But there we go, it's rolling down the canal. Out he pops. Right, so I'm expecting to see an eardrum, but unfortunately there isn't one there. So this is actually almost a false fundus. It's basically it's a layer of thickened skin that's formed in the ear canal. Now this you can't get rid of with suction. This has to be done surgically. You can see a lot of blood vessels running through there. If you go popping that, then you're going to cause problems as far as bleeding is concerned. So this has to be done in a hospital environment. Can't be done in outpatients. And if you just put a bit of gentle pressure, you'll see this give. There. You can see it's quite a thickened up layer of skin. Now thinner pieces you can take away, but that's so thick that it's actually caused a second layer which has blocked the ear canal up. So the eardrum is behind that somewhere, but at the moment we can't get rid of that. So this is what we removed. Obviously the first piece you can see here, that was what we removed from the second ear. Everything else that you can see all came out of the first ear. So you can see there's a fair bit there. These are all the tools we use: Jobson horn, standard size ulnar, and the Crocodile forceps. And here we are. So as always guys, if you did enjoy the video, then please, if you don't mind, liking, sharing, subscribing, that would be great. And we do post new videos, look out for those on Tuesdays and Fridays. As always, take care everybody.